This weekend, we've got nurses that have flown into the nation's capital from around the country, and we'll be going to Capitol Hill in the next day or two to actually speak to our congressional delegates here on Capitol Hill about nurse issues, in particular nurse staffing, because we know, I'm a nurse, all the nurses in this country know the number one issue facing nurses inside our nation's hospitals are that there are not enough nurses to care for the numbers of patients that we're assigned to.
I was moved by the severity on how it has progressively deteriorated. As I talk to nurses across the country, whether in person or online, I get their stories of the bedside. And med-surg nurses taking care of 10 to 12 patients, it's just ludicrous.
On a lot of the floors, those rules go out the window, and people are really put in dangerous situations because they're forced to take more patients than they can physically handle.
We are honorable people that want to do the very best job that we can do for our patients. So we go back up, off work time, call our colleagues back and say, do this, don't forget so-and-so is dying, go in there, be sure you spend a little more time with her because she's very worried or she's very scared. And we were just silent. We felt like if we said something, we'd get on a bad list with our CEO or our nursing officer, or that we would be fired, which we probably would have been. So we just were silent.
I heard from a nurse colleague a story that at first I couldn't credit. She said that on her unit, their staffing, like everywhere else, was awful. She works on a pediatric intensive care unit. They had a child, an 18-month-old, that was admitted, and this child was at death's door, literally. The administrator came by, she was charged that night, and came by and asked her why she had assigned this patient as a one-to-one. In other words, the RN taking care of that patient had no other patients. She was only responsible for that one child. And she then listed for this administrator all the things that were going on with this child and said, she can't handle anybody else. And the administrator looked at her and said, well, I can't imagine why that child has to be one-to-one. Surely she can take another couple of patients. That convinced me more than anything that if this person, an administrator in this hospital, doesn't understand the severity of our patients and doesn't understand what nurses do, then how can I expect the rest of the public to know? So I've got to educate them.
We all feel that pull because you want to do the best you can for your patient, and you form bonds with these patients, and you connect with them on a personal level, and you want to be able to give them the best care possible, but at the same time you've got that push from management and just from the hospital atmosphere that you've got to deliver the best care possible to the largest number of patients possible.
Too many nurses are leaving because of unsafe staffing, and it's driving nurses from the profession. And with a shortage in the crisis that it is, we need not only to do it for patients and safety and quality, but we need to do it to retain the nurses who are there and to encourage nurses in the future to come in and stay in the profession.
Nurses are so busy doing their jobs that they tend to forget to raise their voices as high as they can. But the movement is coming that nurses are finally to the point where they're tired.
One of the guiding principles of nursing is advocacy. We advocate for our patients every day with their families, with physicians, with insurance companies, everything. It's time now we were advocates for nurses because we're at the front lines, and if we don't make changes to improve health care for everyone, it's not going to get done.
At the end of my career, I've been a nurse for 25 years, and if you see me 5 years from now, I'll still say 25 years because I don't want to be getting that old. But being a nurse for 25 years, I started to dream about what would I leave to the nurses who come after me. What would each one of us leave when we pass the baton to the next generation of nurses? And we started to dream about what it could be like.
Every single one of us counts, and if we don't speak up for our patients and our profession, who will? And the sooner we do it, the better it is, because we are in a crisis and it is time that we stand up for it.
Change doesn't happen by itself. It's going to take every nurse in this country to join the movement to change how patient care is delivered and how health care is delivered in this country.